centers, Government of India recruits MBBS doctors. Somebody who can look at the skin, who can look at the delivery, who can look at the chest, who can look at the heart, everything. There's so much of demand for these government posts, everybody applies for it. Even a neurosurgeon applies for it. And that neurosurgeon, when he gets selected, don't ask me how he gets selected, because he's got a very high degree, so he has good reason maybe. When he gets selected, he gets posted to primary health center. Bad for him, worse for the patient. Which means, for the primary health centers, we are going to need the basic doctor, that is MBBS. And the MBBS doctors work well not only in the primary health center, but even in other societies. We used to have a doctor in South Extension when we were students, Dr. Rajinder Singh. He used to practice in South Ex, MBBS doctor. You write from AIMS cardiology clinic, we would write something, or neurology clinic, you write something. He would say, sir, मैं अपना doctor साहब को दिखा के तभी लूँगा दवाई. That kind of a trust he had. And this trust was not only there that time, even now. There was a research study that came out from US a couple of years earlier, that if somebody has to undergo a heart surgery, the results are much better if his primary physician, who is a MBBS doctor or who is like MBBS doctor. He doesn't need to be MBBS doctor, but is a doctor who is willing to look at your whole body. If he is catering to the surgery, if everything is channelized through him, then the results are much better than if the cardiac surgeon directly deals with it, because he has a different, state of mind. So this is important, that for nation we need a lot of primary doctors, not only for the PHCs but many of the dispensaries and other things. So this I just talked about. And the other thing to remember about the nation as such is, the nation has too many problems. We are talking about sanitation these days, which is so very important. We don't have toilet and water and good hygiene. How can the health be good? And if you think that the health of this child is not good, or you see this crowd, don't think we are immune from it. Anything that goes bad with the society is going to afflict us. You cannot stop Ebola, because Ebola affects only the poor African countries. So we have a large number of problems that can be addressed, that need to be addressed, and can be addressed not only by the basic doctor, but maybe less than basic doctor. We are not undermining the specialist. What about at a personal level? Personal level, oh, this slide is not so good. We can probably skip it. This is what I was saying. Personal level, how many specialists do we have? How many do we need? These are the number of specialists that US has. And I said, when did you change it last? Because I have told you our number of specialties and the number of specialists are increasing day by day, every day. In 1.5 years, it has gone up 1.5 times. And this doctor, who is a senior doctor from a senior university, he says, to the best of my knowledge, since 1948, I don't think we have added more than one specialty. We are same 26 boards, and under each board you can have few other specialties, and total will add up to 38, and give and take few others, it is less than 50. So 38 and 26 boards, that is all they have, and they run it. How do they run it? They also get short on the staff. In fact, they had a big problem a couple of years back. They couldn't do the surgery because there was no anesthetist. In anesthesia, the number of specialties that we have, they don't have. We also are short on anesthetic. They also ran short on anesthetic. How did they come out? They said, our nurses, we will train them to give anesthesia. The visits to a doctor is smallest in US, just 4 visits on an average in the whole country, whereas the world average would be 8 to 10, and in our country I don't even know the number, because everybody does shopping. What do? They started something called 1-minute clinic. 1-minute clinics came up in supermarkets everywhere. What is 1-minute clinic? You need just 1 minute to consult the doctor, to consult for your medical problems. So you go in, somebody listens to you, and tells you, you take this, you go home, you don't need to do anything. Maybe 1 out of 100 needs this specialist consultation, we'll arrange it for you. Who was managing these 1-minute clinics? Not doctors, not a single doctor, all paramedics. We cannot allow it because we have a law which we think is written by God and we cannot change it. I don't know how many of you, some of you I know go to US, but I am not sure how many of you have ever need to consult any doctor there. Along with the doctor there, senior doctor, you find somebody who is called an attendant, physician's attendant, who writes the prescriptions. He can write the prescription, give you, chemist will dispense you the drugs and you take it. Who is he? He has nothing to do with medicine. He has never studied medicine. He has nothing to do with it. The reason, why am I bringing these things? I am bringing it that if you want to solve problems, there are ways of solving problems. If you're short on something, you tide over that particular thing by doing something which is practical. Be pragmatic rather than idealist and land up in a bigger trouble. So we have too many specialists, but we need them maybe. This came up in Economist, I think a couple of years back. And what were they talking? Oh, okay, what they were talking, I'll just show you, probably the slides are good. So here we have a slide where this person in the red, assume that he's a doctor. He's a MBBS doctor, basic doctor, generalist doctor. He caters to a dozen or hundreds of these patients around him. Because he says, I can look after all your problems. And believe me, 95% of the problems would settle down with minimal intervention. So he says, I can handle. Once I can't handle, I will refer you. So he is the doctor in the center, one managing 100.